Dr. Rada.
I've started recording. Good evening, Dr. Nam. I'm Asha. I'll start with the OET. Have you done OET before, Dr. Nam?
No, I don't.
Okay. It's more about practicing and talking on like how you deal with the patient. So basically, before they ask the real question, they start very simple questions like they ask you which won't be scored. So these general questions, like on the, can you see on the screen?
Mm-hmm. Yes.
These questions will not be marked because these are just, excuse me, sorry. Excuse me, I'm sorry. Okay, these questions are more like they're trying to make you practice. It's like jogging before you run.
Mm-hmm.
So it's just like for example, let's practice with that. So I'll ask you the question. You can answer whatever you feel like. No need to copy it from the screen. Is that all right, Dr. Nam?
Yeah, okay. Yeah, okay.
Okay. So good evening, Dr. Nam.
Good evening. Hello.
So may I know why you're taking the OET exam?
Actually, I want to finish it to be registered in GMC in UK.
Oh, so you want to work as a doctor in UK, is that so?
Yeah, that's right.
So how long you've been working as a doctor?
Oh, so a long time, 20 years.
Wow,
Yeah.
you're a practicing surgeon, I believe?
Yeah, I'm a pediatric surgeon, subspecialty.
Oh, pediatric surgeon. So it's more than 20 years.
Yeah.
So how about your working hours? How many hours have you been working?
Actually, for here in Oman, it's demanding every day 8 hours, but on call it will be 24 hours, and we are doing more than 6 on call per month.
Oh, that's a lot of loads. And
yeah.
So why, it looks like a very busy schedule. So why did you choose medicine as a career?
Actually, from when I was little girl, I like to be a doctor. I want to help people. That's my aim, actually.
So, why did you choose your specialty? So, what's your specialty? May I know again? And why did you choose that?
I am a pediatric surgeon. Dealing with pediatric is something interesting for me, and to deal with mother and baby is something fine, rather than dealing with only adults and male and female, and that's bothering through here. So I choose that, and it was nice for me to be surgeon, and for surgeon for pediatric is something tiny little things. Nice.
Oh, okay. So what advice can you give to the fresh graduates?
Do whatever you love.
Oh, okay. Do you think do you advise the fresh graduate to follow your career path, becoming pediatric surgeon?
It is not an advice, but rather than just what I mentioned, do what you love. Because you will not be creator in your work unless you love what you are doing.
Okay. So according to you, how to be a successful physician or a successful doctor or a surgeon?
To work hard and to follow the updating things, and not to be bored of anything you are doing. It's beneficial for even if you are not benefited from now, it will be beneficial in the future.
Okay. So what was the last training you had?
Last training of what?
Like any medical training you had?
Just like here in Oman, I just entering theaters and working as specialist. That's it.
Oh, so did you take any course or any diploma or any?
Yeah, I finished my MRCS here, and also I am working for pediatric life support, like a course, and here and there joining meetings through online nowadays because of Corona. That's it.
Okay. Okay, so what is the recent medical advance you have heard about medicine? Like, what are the breakthrough you have heard?
Laparoscopic surgery, thoracoscopic surgery for tiny babies, just when they age and they are going through thoracoscopic surgery.
Oh, that's great to know. So, okay, so I think you did great. I think you're very thorough. And only I remember here, like, for example, when I ask you in number 7, for example, if anyone asks you, like, how to be successful physician or something, the main thing what you can say, like, don't try to give incomplete sentence. For example, if I say, so how to be a successful physician, you just said work hard, follow your dreams. You cannot say like that. You have to complete a sentence. So you always remember a sentence should be complete. Not like talking to a friend. You have to understand you're professionally talking, so you have to give them like, so as far as this medical profession is concerned, what I can tell the fresh graduate is that you have to focus on your career path, or don't lose hope, or follow your dreams. And I think like you can make a sentence. Can you do that for me? I'll ask that number 7 again.
Okay, so
just
ask me again and I will.
Okay, just I think others were great. You did great. It's just that I want you to answer. Just practice giving a complete sentence, not half, because if you give half, it's not professional. So I'll just So Dr. Nam, can you tell me how to be? Can you give any suggestion how to be a successful doctor?
Okay, as far as I'm a professional pediatric surgeon, from my point of view, the most important thing is to follow up. The most advice I want to say for those who newly graduate: follow your dream, love your work, and work hard. Don't give up at all, and this will help you to reach the target point.
Okay, so that's good. So not as I'll just correct a little. Not as a you have to say, as a pediatric surgeon, I would like to advise, or since I am. There are two. Do you have a note? Can you write it down? So
yeah.
You just remember, because I think you might get mixed up while saying that, but be very clear. Like, for example, as I am a pediatric surgeon, what I would like to advise. You can say that one sentence from that, or you can use, since I am a pediatric surgeon, what I would like to suggest or advise my future colleague or future fresh graduates or the newly trained doctors, that you have to focus and you have to keep on working hard. Just as when you're using as and when you are using since, you have to make it clear, because you got a little mixed up with as and since.
Okay, fine.
Did you understand? Okay, so just okay. So what number 8, when I asked you, what was the last training you had? Actually, this doesn't add to the score, but if you keep on practicing, it will be easy when you go to. So I'm just making you practice. So what was the last training you had when you asked? You were very confusing at this. So just keep 1 or 2 thing in your mind. Like you already have an answer, like laparoscopy for the children and something. So can you answer that again? Because it got a bit confusing, because you did not understand the question. So when you don't understand the question, you can ask the doctor again. I beg your pardon, can you please repeat the question, please? You can say that.
Okay, fine.
So that sounds more professional, because it's all right if you don't, if you didn't hear for the first. Okay, so Dr. Nam, what was the last training you had?
Well, I just finished my MRCS here in Oman, and I joined many online sessions for new advancement in pediatric surgery, and I do join some courses for pediatric life support.
Okay, that's great. So I think that's great. So far this first page, we're done. Okay, any question you want to ask me?
No, thank you.
Okay, I think you did great. So and so this one is like we're doing a role play, because that's how they ask. So the main thing, so we are going to the OET where they do the role play type. So first they have to introduction, and introduction is very important because that shows that you how you introduce yourself to the patient. And you have different way of introducing. For example, for example, I'm the patient. How would you introduce yourself?
Now I'm going to say, hi, I'm Dr. Niam. I am the attending physician doctor today, or doctor today. May I have your name, please?
Okay, so that's good. So, but we cannot say hi. We have to be very professional. Good afternoon.
Good afternoon. Okay.
Good morning, good afternoon, or good evening. So three. Just write it down. Just to freshen up. So whenever you, because I am also practicing that good afternoon, because we also don't have. I am used to saying hi like that. So yes. we have to practice that. So whenever you see, whenever I see you, and whenever you see me, we'll just say good afternoon, Dr. Nam, and you say good afternoon, Doctor, or you say good afternoon, Asha, or whatever. It's okay. So once again, so first you have to say good afternoon, then or good morning, whatever, and then introduce yourself. My name is Dr. Rana, and I'm the I'm the doctor for today. I'm what you say, I'm the pediatric surgeon for today, or I'm the treating doctor for today, because I'm the one treating the patient. So you have to introduce yourself. So how can I help you? So you have to ask the patient, what is the problem? So first you good afternoon, then you introduce yourself, and I say that I'm the like pediatric surgeon of this hospital, and how can I help you? It's okay.
Okay, but before that, can I, because I remember we talked about that we have to say, may I have your name, please? If he's in hospital, an inpatient, we have to say, may I have your name and age, please? That's right.
That's correct. That's correct. Okay, you just follow that. I'll let you know when you have to.
Okay, fine. Okay. So to start with, what?
You just I'm the patient. So you start asking me.
Okay. Good afternoon. I am Dr. Niam. I am the attending doctor today. May I have your name, please?
Okay, thank you. So you can may I have your name, please? And can I check your? I don't know if you have to. I think this is also important because we have to check the patient number, hospital number. Those are very important because we can't. Can I check your name and your hospital number, please? Those are also important because when you're working in a hospital, you have to make sure that's the patient you're treating, and that's the correct hospital number. So you can add that also. May I have your name, please? But I think that is after this one. I think first. Okay, you ask me, I'll answer you, and then you ask me again.
So may I have you or check your name, please?
Okay. Hello. Good afternoon, Dr. Nam. I'm Asha.
Hello.
And okay, first of all, you greet me, then we'll follow this conversation from the beginning. You just say good afternoon.
Okay, good afternoon. I'm Dr. Niam, and I'm the treating today, doctor today. May I have your name, please?
Good afternoon, Dr. Nam. My name is Asha.
Hello, Asha. Okay.
Hello.
And can I check your hospital number?
Yes, this is my hospital number.
Okay, thank you. And how can I help you today?
Okay, no, that's correct. Okay, let's, so this is the flow. You can write it down, just remember the flow. So make sure you write, you greet and introduce yourself, and then ask, how can I help you? Then the patient will answer it. Then can I check, first, how can I, may I have your name, please, first? And you ask, and can I check your hospital number? Yeah, okay. But I'm not sure if it's very specific. I think name is all right, but usually we do both name and hospital number both, I think. But
so what about how may I address you? I remember in previous session, just you said that, may I have your name and how can I address you?
that is first after I give my name.
Yeah, okay.
First you have to ask first you have to ask, how can I first just ask me what's your name, this one.
Mm-hmm.
Okay, how can I address you? Okay.
Mm-hmm.
So Miss Asha, so how can I help you?
And then after the name, how can I address you? I will check for your hospital number, or
Yes.
it is
Yeah. As long as you don't forget. But I'm not sure how they do it, but that's the basic standard. You have to check the hospital number just for sure. But it's better if it's to be safe. And I don't think so. Even if you forget, it won't be, but it's better you keep it in mind that you have to ask the hospital number.
Okay, fine. Thank you.
Okay, let's start with the introduction. Okay, you're the visiting doctor.
Okay, fine. So I will start. You mean I will have the history that written in the card?
Yeah, but no, I just want you to general, just an introduction. We are not starting. I just want you to practice the simple introduction.
So another time you are asking me to introduce. So good afternoon. I'm Dr. Niam. I am the attending doctor today. May I have your name, please?
My name is Asha Rana.
Okay. And how may I address you?
You can call me Asha.
Okay, thank you. Can I check your hospital number, please?
Yes, here it is.
Okay, thank you. And how may I help you today?
Well, Dr. Nam, I'm not feeling well today, so I came. Okay, that's it. That's good. So you remember the introduction. Very simple.
Okay.
This you remember, right? Very simple. Just make it very comfortable, as if you know it's like, don't try to memorize. Just go with the flow. It's very easy, so it doesn't look like you memorized. Okay. So this one is the introduction is very important, because they say how you introduce yourself and how you ask the patient or make patient comfortable. Then comes the sympathy and history. Mm-hmm. So when we're dealing with this history and sympathy, so you have to show because there are different, like breaking bad news, or there are different scenario. So you have to be very apologetic, in a sense, very empathetic, like, oh, I feel very sorry to hear that. Like our tone, mostly the tone, we have to reduce the tone, like, oh, I'm so sorry to hear that. And so we have to practice that a little bit. Okay. Like, oh, I'm really sorry to hear that. It must have been very painful. It must be stressful for you. These are the sentences you have to remember. If I say, Dr. Nam, I'm really feeling pain in my hand. And what will you say? Dr. Nam, I'm not. You ask me, how are you, Asha? Like,
oh, okay. How are you, Asha?
Well, Dr. Nam, my hands is really aching since yesterday.
Oh, I'm sorry to hear that from you. And I know I can know how it will be painful, but I can reassure you it will be better after this conversation.
No, the tone, we have to reduce the okay. For example, you tell me, okay, I'll ask you, how are you, Dr. Nam?
Well, I'm not well. You mean
you become patient. You become patient for a while.
Patient. Okay. Well, today I'm not well. I feel I have some ache in my shoulder.
Oh, I'm really sorry to hear that, Dr. Nam. So, how is it very painful?
Yeah, actually, it's painful. It cannot. I cannot sleep well at night. It always annoying me.
Oh, it must have been very painful for you. I can understand, but don't worry. I'll try my best to help you in whatever way I can. So do not worry. So little bit tone. So I'll do the same thing. Okay, I'm the one showing the pain. So you'll be the you're the one. Okay, you can ask me again.
Okay. So how are you today, or how can I help you today?
Yeah. You can say how are you today, or how can I?
Okay. How can I help you today?
Dr. Nam, I'm having this headache for like a whole day, and I'm not able to sleep properly.
Oh, I'm sorry to hear that from you. I
No,
know.
wait. Oh, I'm really sorry to hear that. Just pause. Don't say, because when you say, because the tone of the English, the empathetic should be little low, like, I'm really sorry to hear that. That's it.
And to stop, okay?
Yeah.
And then after that, I will say, I will, okay, okay. Oh, I'm sorry to hear that.
Oh, yeah. Because it sounds, because it should sound real. Because if you say, "Oh, I'm very real," when you say like that, I'm very real. Sorry to hear that. It sounds like you are memorizing.
Yeah.
Because your tone, your Arabic tone comes in the English is different. So we have to manage that one. So you have to act. You have to like, "Oh, I'm really sorry to hear that." Like,
Okay.
you're really like. So if you make it long, they will know you are memorizing. It sounds memorizing. That's why I make it short. Like, I'm really sorry to hear that. Like, just acting.
Okay. Oh, I'm really sorry to hear that.
Yes, that's correct.
Okay.
So we have to. So, are you afraid, or what are you concerned? You can ask me more. Like, so are you worried, or are you afraid of something? Do you have anything to ask me? You just you're just trying to show that you're very concerned. You're very sorry for me. Okay, we'll practice that. Okay, you ask me again. How are you?
Okay. So how can I help you today?
Oh, Dr. Nam, I'm having this headache for a whole day, and I've not been able to sleep properly.
Oh, I'm sorry to hear that. Are you afraid of this? Are you worried?
Yes, I'm just worried because I've not been able to sleep and I've not been able to eat. So, can you help me?
Yeah, of course, it's understandable. And believe me, I will help.
Yeah. After you say yes, I understand that. So, but would you mind if I ask you a few more questions regarding this situation? That's it.
Okay, fine. That's it.
Also,
So I will not continue. Fine.
Yeah, just try to be specific and try to ask. So, would you mind if I ask you a few more questions so then I can help you? Like that.
Oh, okay.
Because I'll say, "Can you help me, doctor?" And say, "Sure, but can I? Would you mind if I ask you a few more questions?" So you'll say that, and I say, "Okay, sure," like that. Okay, one more time.
Okay, fine. So how can I help you today?
Well, Dr. Nam, I'm having a headache today, and I've not been able to sleep properly.
Oh, I'm sorry to hear that. Are you afraid? Are you worried?
Yeah, I'm a bit worried because I've not been able to sleep properly. So can you help me?
Yeah, I can understand. So would you mind if I ask you another more questions so I can help you?
Yeah, sure. Okay, that's correct. Okay, we're done with the starting.
Yeah,
So,
fine.
So can we introduce and can you add this one too? Introduction and this, let's add.
Yeah, okay. Well, good afternoon. I'm Dr. Niam. I am the attending doctor today. May I have your name, please?
Good afternoon, Dr. Nam. My name is Asha. Asha Rana.
Okay, and how may I address you?
You can call me Asha.
Thank you. And can you give me your hospital number? Can I check it, please?
Yes, here it is.
Okay, thank you. How can I help you today?
Well, Dr. Nam, I've been having this headache and I've not been able to sleep.
Oh, I'm sorry to hear that. Are you afraid or worried?
Yes, I'm a bit worried because I've not been able to sleep properly for a very long time. So can you help me, Dr. Nam?
Yeah, I can. I'm so sorry to hear that from you, and it's understandable. But so would you mind if I ask you more questions that I can help you?
Yeah, sure. Okay, that's it.
Thank you.
Okay, let's now you have to ask more, like you have to clarify more, like
Okay.
what about your appetite, What are you eating?
Yeah.
Do you have this?
Symptom.
Yes. So
Okay.
so it depends on what are the what's the topic we are given, or what's the case we are given. So we'll go according to that. Do you have this symptoms? So you just go through that. Okay. Then we go to the site. Which body part?
Okay.
Can you tell me where the pain is? Can you tell me where it hurts? And duration, how long it has been going on, and how long you've been suffering. And so at the end, you have to know, like, have you taken this one? Have you taken this medicine? And is there anything else? Like, in the end, you want to clarify everything. Like, is there anything like you want to tell me more, or anything you want to clarify? So we're just collecting all these provisional diagnoses. So next is the diagnosis. So you have to say, well, Asha, based on your symptoms, and after examination and whatever you have told me, I believe that you have what is called like appendicitis. And let me explain to you, okay? You can say that, I believe that you have appendicitis, and pause. And because the patient may react like, what? Appendicitis? I'll say, well, don't worry, I'll explain to you. Okay. So can you say that the diagnosis, well, based on your, can you say that and stop, and I'll be shocked.
Okay, fine.
Okay.
Depending, Ms. Rana,
Yes.
depending on what I've examined you, and after all these talking, I believe you have appendicitis.
Appendicitis, doctor? What is this? I'm so scared. What is this?
Well, don't worry. I will clarify everything for you. Appendicitis is mean an inflammation of appendix, that is small, tiny little things in your tummy. And when it's inflamed, it causes some pain. So, and this will need to do surgery.
So you can say, one way of saying is that. Another way of saying is that to be like, because some patients are very scared, right? So we want to be very gentle with the patient. So what we're gonna say is like, well, Asha, we talk about your symptoms. I'm just giving you example, because the one we just did was we talk about this a while ago about, like, what's on here written. But another way is like when I say like, for example, you are the patient, and I say, so Nam, we talk about this, what happened to you, and we talk about your symptoms, all the signs, and I feel that based on all this, I've come to the conclusion that or a provisional diagnosis that you may have what we call appendicitis. Do you know what is appendicitis?
And then okay, fine.
So that's another way of, so you can use both way. So you don't have to fix in. So learn like, because you don't want to at once tell you have appendicitis. That means the patient will what? Or otherwise you can be very gentle and say, we talk about all the symptoms you told me. And I would like to know, do you know this appendicitis? Have you heard about it before? And I say, no, doctor, what is it? Well, I think this is this, and I think you may have this appendix. So you can go gentle, two-way. You try that one.
Okay. So we will try both. Okay.
We talked about your symptoms like that. You easy way. You like, not so fixed.
Just a minute, because we talked that I said I believe you have appendicitis, and then you shocked. So I
yeah, that one is one way. Okay.
I try to calm you down. That's it.
No.
And this is why.
Yeah, that's
and the other way to be gentle with you. So
yeah, very
I will tell you from I've examined you, and from the examination, I think that you have appendicitis. Did you hear about this before?
Do you know what is appendicitis? Not
okay.
Did you hear?
Okay. Do you know so far what's appendicitis? Okay.
No, not so far. Do you know what appendicitis is, or do you know? Have you heard about appendicitis? Like, Like, do you know anything about appendicitis? So if a person says, no, I don't know, so don't worry, I'll tell you. Because we also have to see that how much the patient knows. So you cannot give shock directly. We are just being gentle.
Okay.
Okay, you can practice that.
Okay, from the beginning or just from this?
It's up to you. If you want to start from the beginning, it's better.
Okay, fine. Well, good afternoon. I'm Dr. Niam. I'm the attending doctor today. May I have your name, please?
Hi, Dr. Niam. I'm Asha Rana.
Okay, and how may I address you?
You can call me Asha.
Okay, thank you. And may I check your hospital number, please?
Yes, here it is.
Okay, thank you. How can I help you today, Rana?
Well, Dr. Nam, I'm feeling headache since morning, and I've not been able to sleep properly. And I'm like, I don't know what to do.
Well, I'm so sorry to hear from that from you. Are you someone afraid from this?
Yeah, I'm a bit worried about this because I've not been able to eat as well. Can you help me, Dr. Nam?
Yeah, of course, I can understand your worries. So would you mind if I ask you more questions?
Oh, yeah, sure. You can ask me any question.
So I can help you. Can you just tell me the other symptoms? You have any tummy pain?
No, I do not have any tummy pain. It just I have a headache since this morning.
Just headache. And
yes.
Do you have any temperature?
I beg pardon?
Temperature?
No, I do not have any temperature or high fever.
No. So you mean the only thing is that headache? You don't have any associated like vomiting, or you don't like to eat anything?
Yes, that's I feel like vomiting, and I don't feel like eating anything, and I feel nauseated as well and dizzy.
But no tummy pain?
No tummy pain.
So I think you have to have some investigations. Before I have to examine you first, would you mind if I examine you?
Yes, please go ahead, doctor.
Okay. Well, after my examination, I believe that you have something known as appendicitis. Do you know anything about this?
No, I haven't heard about appendicitis. What is it, doctor?
Well, it is something related to your tummy. It is an organ, small organ in your tummy. When get infected or inflamed, it make that pain or that headache and little bit fever, or sometimes without fever, but you averted to eat anything. And if we can go through another examinations or investigations, we can reach that final diagnosis.
Oh, I'm scared, doctor. Is it scary? Because I'm afraid. What is it? Do I have to operate or what is it, doctor?
I'm so sorry. It's understandable that you are in shock, but let me more clarify for you, and let me assure you that it is something simple, not so something scary or something not treatable. It is manageable, and we can treat it simply. Sometimes it will respond to treatment, no need to go through surgery, but definitely the surgery is the final treatment. And it will be easy thing, not so major thing. Do you understand that?
Yes, doctor, I understand. So will I be okay after the operation?
Yeah, of course, the headache will be finished, and you will be well within 1 day. Especially the new approach will be through laparoscope surgery, and it will not take a few hours only. Is it understandable for you?
Yes. So I will do some I'll do some examination. Is that correct, doctor?
Yeah, you have to go through blood investigation first, and then we will go through ultrasound. Do you know what I mean by ultrasound?
Yes. That means I have to do X-ray.
Just like, no, it is not X-ray. Just like the thing that done for that pregnant one in the womb, something in the womb to be done by ultrasonography. It's known as ultrasonography. Is it clear for you?
So, but I'm scared, doctor. I heard that I have to go inside this X-ray, like a big, like what they call MRI. I'm just worried, doctor. What will happen to me if I go inside? I don't want to do ultrasound, doctor.
No, MRI is something different. Ultrasound is not like an MRI. Ultrasound is simple device. It will put the probe at the head of that machine. It will be something small, tiny little thing to be put on your tummy from outside. Nothing more. With
Oh,
that.
okay. So it
Mhm.
will not cut my it will not cut my stomach, is it?
No, at all.
So
Don't be worried.
so will I have to go to the will I have to undergo operation or not, Doctor Nam?
It depends on ultrasound. I'm just suspicious of appendix. If it is confirmed and your symptoms continue to have like this, we certainly go through the surgery. But as I've told you, it is simple, not major. Don't worry.
Okay. So okay, I understand. Now, thank you for explaining to me, doctor. Understand. So, do you
So
think why do I have appendicitis out of nowhere?
here it is something related maybe to the diet that you are taking, not good diet, not contain enough fibers, or sometimes it is inherited running through family. Do you have any member of your family have such a problem?
No, I do not. Yes, yes, yes. I do.
Yeah, okay. So sometimes it is running through family for no cause. Sometimes it is if you have constipation and the fecal matter so hard, it will cause obstruction of the appendix and causing this pain and this inflammation. Is it clear?
Yes, thank you, Doctor Nam. It's clear for me.
So thank you for you also. Do you want anything that to clarify more?
No, I think everything is clear, Doctor Nam. Thank you
Okay,
very much.
thank you. So today you came with this your complaint we talked about, and we talk about the examination and possibility and investigation we will do, and the steps that we will follow, and maybe end with surgery. I hope everything will be okay after this investigation, and we will reach the diagnosis. Don't be worried. Thanks.
Thank you. Thank you very much, Dr. Nam.
Thank you, but it will take too much time, not 5 minutes.
Yeah. But anyway, we are just we are not in time constraint. We are just how much you know, like, but you that means you already know the flow, what you have to do.
Yeah, okay,
Right,
fine.
you should know because I didn't tell you, but you're going, what comes after this. If I'm like, oh, I'm afraid, then you have to say, don't be afraid. So what will happen to me, doctor? Say, so we will gonna do this, these are the things we're gonna do, then will happen. So what is this? I'm afraid of x-ray, or I'm afraid of MRI. No, it's just a simple thing, blah blah. Then what will happen to me? We'll check, and if you have this, you'll go to you'll undergo operation. If not, you'll be okay. And so, oh, okay, that's all right. So why did this happen to me? So, because you are not having proper diet. Oh, okay. So it's better and maybe you have family history or some family history, you have to write that word because you forgot how to say it, because someone in the family, rather maybe you have a family history, which means maybe someone in the family has it. You can write these words are important. So I think you know the flow. You just need to memorize in your mind, like what comes after this. Okay. Sometimes I say, Dr. Nam, I don't want to do it. I know I don't want to do it because I'm scared of operation. And then you have to, no, it's good for you, because if you don't do it, then there will be more serious complication. You write those words, serious complications.
Can I say it in other way that this is a protocol and we have to follow your best interest, finish it?
Yeah. Yes, that's okay. Just but you have to know these words, just in case you forget. You have to pick up this, and like that's this is for your best interest. And also, if you do not know, there will be further complication. So we don't want that to happen to you. Like, so we are convincing you, so we should be very good at convincing. So I think we did good this one so far. We're not in time constraint. We're just like, trying to see how much can we go with the flow. So others are special cases, breaking bad news, and this one. I think, is it okay today this much? Because I don't want to put too much.
Okay. Whatever you want. Whatever you want.
This one is very good, and you did very good, because I think you are already good in practice. You just make it short. For example, what I noticed, you have to know, like, maybe someone in your family, or you have a family history. Do you know anyone in your family? You should, like, for example, how to say a family history. Do you have anyone in your family? You can say that. Do you have anyone in your family who has appendicitis? You can write that. Or do you have a family history? You can say two. Okay. Yes. So others is like others are. I recommend that you should do this examination, or I strongly advise that you should lose weight, or you should memorize these simple words like I recommend, I strongly advise you, I'm concerned about your smoking habit. These are very important. Like, you don't know which one will come. For example, what if a person have a heart attack because of the smoking? So you have to say, I'm very concerned about your smoking habit. So I insist, or I have to emphasize that it's very important that you stop smoking. And we can help you with that. We can suggest you someone, the smoking, they have this, what you call the, you can
supporting group.
Support group. You can advise a support group for you. So you should know, what if the patient is asking, for example, physical therapy, who cannot move. So don't worry, we can refer you to physiotherapist. So you should know in your back of the mind what you're going to do. I refer you to physiotherapist. If you are smoking or alcoholic, I'll refer you to alcoholic group, Alcoholic Anonymous group, or a group that will help you to get rid of this habit or addiction. So you should know these words.
Okay.
So once you know this one, so anything will be easy. Others are just like just practice only. So we can do those practice, no big deal. The main thing is how the flow. If I ask you one thing, you should know what the next should be. And for example, if I don't say anything, you should be able to pick it up. Like, so what can I do for you? Don't worry, you can relax. I'll make, like, you have to, the main thing is, it doesn't matter what you're saying. Like, for example, for headache, you can say appendicitis. It's not matter. But what matter is you are saying the English fluently without stopping. That's more important.
Okay, fine.
So I think you are doing good. So this much for today, I think.
Okay, fine. Thank you very much. We previously did one session for breaking bad news.
I think so. And now I remember.
Yeah, we did it before.
Yeah, breaking bad news. I think we'll do it again one more time, and we'll finish all these, all of it. No worry.
I wanted to. Thank you.
So when do the next will be? Let me see the schedule.
whatever you want. I am available every time. Do you want to tomorrow? It's okay.
Dr. Loretta has given me on the third. Day after tomorrow.
Day after tomorrow, fine. In the same time?
Yeah, it's 5 o'clock, right?
Yeah, 5 o'clock in UK. Fine. Okay.
5 o'clock. So you just practice what we practiced today tomorrow. So okay. You just the flow should be fast. Like for example, I say, oh, I'm feeling headache. I say like, oh, don't worry. You should know how to catch me. Like for example, if I'm quiet, I know you're afraid, but don't be afraid. You are in a good hand. Or that's also, you write it down. You have to write that. Okay. Please don't worry. You are in a good hand. That's very important.
Yeah.
I can assure you, you are in a very good hand. So you do not need to worry. So you should be very fluent, like, a professional, it doesn't matter what, if I say headache, you can say appendicitis, doesn't matter. But as long as you're saying, it's okay, I can take care of you. Like, just acting.
Okay, fine. You say headache. I wanted to convey to say something else, but because we already say appendicitis before, so I could,
yeah, it's okay. It doesn't matter. We're just practicing how good we are. It's okay. So okay. Thank you very much.
Thank you for your help. Thank you.